This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Okay, great. Yeah, I'm Dr. Michael Edgeloni. I'm over at the Wayne State University Detroit Medical Center program. I have with me a couple of my senior residents, Dr. News Shaw and Dr. Arthur Yan. So we thought we'd take this 20 minutes, kind of go through a presentation, give you a rundown on the program and what we have to offer and what you might find here. And then we'll take your questions. If you want to text them in while I'm talking, my residents will reply to you. If you want to wait till after, we can do that too. Let me go ahead and get started. Okay, actually, let me do the share screen. It'll function first. All right. So these are the hospitals that we work with. This is our Rehab Institute of Michigan, the top left. Then we have Detroit Receiving in the middle on the top. Carmanos Cancer Institute over on the right. Then on the bottom left is the VA Medical Center, just across the street. We have Children's Hospital in Michigan and Harper Hospital. And 5 of these 6 hospitals are connected by an indoor tunnel system. So when you do your inpatient, some of your outpatient and other core rotations, you'll have access to these hospitals by foot, indoors, no matter the weather, which is always nice. This is our hospital, the Rehab Institute of Michigan, or RIM. It's got 69 beds, CARF accredited, JCO certified. We have our outpatient clinics spread out through several of the floors. We have an interventional spine suites. We have multiple outpatient gyms. And on inpatient, we have 3 full floors of inpatient, which I'll show you. And each of those floors has its own gym. So we have an interdisciplinary team of physiatrists, internal medicine, PT, OT, speech, therapeutic rec, neuropsychologists, kind of you name it. We'll have there for our patients. This is the 6th floor where I work. There's a workroom that you can see there. We've got a nice little view of Detroit. And I am the medical director of the inpatient neuroscience unit, which includes TBIs and strokes. We have a minimally conscious program that we've been running for over 10 years now. So we'll take a lot of the minimally conscious patients in Southeast Michigan. They kind of funnel through our system, through our hands, which is always amazing to do. We have a locked unit. So this is a 17-bed unit where patients have 24/7 video monitoring. They're not allowed to, go down the stairwell or get on the elevator. They have a device that kind of keeps them from being able to open those things. We have a 0G, so one of the equipment that is at our disposal. You can kind of see it there on a track on the ceiling. We've got things like Dynavision. This is just other parts of the 6th floor gym. So that's always an exciting place to see your patients work. On the 4th floor, our second of our 3 floors of inpatient, Dr. Aaron McCarty is the medical director of inpatient general rehab. We see a pretty diverse population. We get a lot of transplants from Henry Ford Hospital down the road. Carmanos gives us a lot of cancer patients. We have amputees and burns, largely from Detroit Receiving. A lot of critical illness, long lengths of acute inpatient stays that come our way, lots of trauma, and the trauma feeds the general service. It feeds, spinal cord. It also feeds the TBI units. And then we have the third floor. That's led by Dr. Bush Arnold. He's our medical director of spinal cord injury. It's a dedicated unit to those patients with SCI. We have a urologist, an internist, and wound care kind of dedicated to that floor. We do have a comprehensive outpatient program as well, kind of linked to our inpatient SCI gym. And this is what the gyms look like. This is the outpatient one. We have an exoskeleton. We have a wheelchair seating and mobility clinic. Recreational therapists, adaptive sports are something that we support and utilize at the Rehab Institute. This is some of our other equipment. And then on the outpatient side, we have interventional pain combined with outpatients just flowing from the inpatient side, TBIs and strokes, spinal cord injuries, amputees, burns, musculoskeletal injuries, polytraumas. A couple of years ago, we introduced a continuity clinic, which has really been a favorite of the residents. In fact, that was promoted by them, and they do enjoy it. So once a week, they come off their rotation for a half day, and they follow their patients in continuity for 2 to 3 years. So that's a nice addition. We do things like Botox and EMGs, baclofen pump management, joint injections, and of course, all the interventional pain procedures that you might find, epidurals. We have a fluoroscopy suite right at RIM, medial branch blocks, ablations, rhizotomies. We have introduced stimulators into our program, including peripheral nerve, spinal cord, DRG. So that's been pretty interesting. Dr. Mahmoud Sabah on the top left there, he's been getting clearance for adding a lot of these additional procedures. Right now we have 3 interventional pain physicians. There are some of the residents and attendings having fun, hopefully with a mannequin, I don't know. But we have this kind of newly finished fluoroscopy suite that they are having a good time in. We have an outpatient cardiac rehab program. This is more focused on phases 2 through 4 of cardiac rehab. This is the Brazza Center. If you notice in the pictures in the beginning, there was a building outside of RIM. Well, this is Brazza, and this is where a lot of our outpatients can get some dedicated rehab. And even our residents can go here and exercise if they like as part of the program. We have outpatient PT, OT, and speech. They do car transfers. We have a car kind of sitting there on the first floor of our building. The inpatients and outpatient therapists use it quite frequently. Children's Hospital in Michigan is right next door. So this is 2 months of rotations. They have 14 beds on their inpatient ward. They do procedures alongside neurosurgery. They do a lot of baclofen pump managements and refills. They do a lot of Botox on kids. So that's a nice adjunct to our program. And we have a consult service. So we spend 3 months doing consults here on the main campus, and this covers Detroit Receiving, Harbor Hospital, Carmanos, those hospitals I showed you in the beginning. And really all the diagnoses we had mentioned, you can see on consults. So you can see them early on. You can decide with our attending Dr. Papalakis, who's a good candidate, who's not, what kind of things we can do to help the acute care team improve this person's life. We see a variety of patients. Resident continuity clinic, as I mentioned, this is led by Dr. Tyler Williamson. He is a graduate from about 3 years ago, and he now leads the continuity clinic, and residents do enjoy that. These are the resident quarters. In case you're wondering, this is all one suite you're looking at. So on the left is the sleeping quarters. And then outside of that, the two pictures next to it are the kind of the lounge where they've got a couch and a TV and several computers with dictation ability. You see the fridge and lockers and kitchen, and they're a little spoiled, but it's a nice relaxing area. And as you can read there, we've got on campus different things within the hospital to eat. We got the Dunkin' Donuts, Starbucks, Chick-fil-A, Subway, Wendy's, Happy's, and you can order out, of course. You're also given meal cards, which renew every year, that allow you access to the food court where you can get a variety of food. We have some other rotations, which include EMGs at the VA with Dr. Lim. We have a P&O rotation through Wright and Philippus. It's an orthotics and prosthetics company. Sports medicine rotation. You'll do rheumatology on both the inpatient and outpatient sides for 1 month total. You have a PT and OT rotation combined with neuroradiology. So it's 2 weeks of PT and OT combined with 2 weeks of neurorad. So you can sit next to a radiologist and kind of read CTs of the brain and spine and MRIs. It's nice for the residents. We introduced that about 4 years ago. We have a neurology rotation, orthopedic surgery rotation. You'll do a 3-month rotation with Dr. Seidel doing outpatient PM&R for a variety of diagnoses. He's in the suburbs. He also does EMGs with you. And you have outpatient PM&R with Dr. Biglin and Dr. Arbit, 1 month each. And if you were wondering if there's anything left, there's 3 months of electives that you can take advantage of. These days, people are applying to fellowships so early, so you can do an elective during your PGY2 year. Our 2 residents on the line here, one's going to Harvard to do brain injury rotation. Another one went out of state to do a pain rotation. So that's some flexibility we try to give the residents to make them competitive and to learn, a new area and a new location. Our didactics consist of monthly grand rounds, monthly journal clubs, monthly M&M. Unfortunately, it happens. A PGY2 boot camp, which we're currently undergoing, and the PGY2s are picking up steam as we speak. We've got musculoskeletal didactics, of course, EMG, TBI, stroke, spinal cord, P&O, kind of all the diagnoses we talked about. We have a recurring 12-month didactic cycle that we go through. At the bottom there, you'll see we have 3 separate courses. One is an ultrasound course, 4 hours times 8 sessions, so 32 hours over the course of the year by Dr. Buffard. He's a musculoskeletal ultrasound professional. He's very good. Then we have an anatomy course by Drs. Seidel, husband and wife, the same Seidel you saw earlier, hosting the outpatient rotation for 3 months. He and his wife do an anatomy course as well as an EMG course. So you'll have the ultrasound, anatomy, and EMG courses throughout the year. All right. This is the anatomy course. So we use a cadaver. Those are some of our residents, and Dr. Seidel kind of in the middle ground there. We have the EMG course, practicing on each other. And we have an ultrasound course that we mentioned, and we're going to be getting 3 new ultrasound machines this fall. So we're pretty excited about that. No more using older machines, no more borrowing. We're going to have 3 brand new ones. So that's going to be great. These are some of our residents. These are more of our residents and their significant others. These are some residents and now some attendings that work with us. These are some of the things Detroit has to offer. I'm sure you guys will look if you're interested, but we have all the major sports teams down here, 3 big casinos, lots of other things like the Opera House and Fox Theater, many different things to do. Detroit's changed a lot since I was a Wayne State student over the past, I say 15 years. The downtown area has really developed. It's a nice place to even take your family. All right, and that's my program coordinator's email address. It's Colleen Harboe@wayne.edu. If you want to contact her, if you want to contact us, we'll put our emails in the chat. And let me stop the sharing here.
That was a fantastic presentation and fantastic timing. You got about 5.5 minutes for questions.
Okay. All right, guys, let's hear it.
I'm going to go back, and there's a couple questions I think I missed. Karam, yes, with nearly everything being in-house for long-term continuity, does it allow patients to have access to all the resources needed for their care? The care in Detroit is pretty comprehensive. There's a lot of outpatient programs around that we actually do with the other hospitals as well. A lot of our patients come from out of network, so Henry Ford, University of Michigan, even Oakland University, kind of all over. We get patients. We have a patient from Cleveland right now, from the University Health System. So we coordinate care with a lot of different teams in the Midwest region in the Detroit area. So I don't necessarily think it's kind of limited in terms of access to care. What is it like to live in Detroit? Do most of the nearby? So all over. I live in Detroit, in Midtown. It's very convenient. I can walk to work in about 2 to 3 minutes, which is definitely a perk. Anuj and a lot of residents live kind of out in the suburbs as well, Ferndale, Royal Oak, but the highway system to get in usually only takes 10 to 15 minutes if you want to live out in the suburbs. There's a couple of us who live a little bit further, but the commute is kind of up to them at that point. Anuj, if you want to.
Yeah, I think there's a couple more on here. So what's your call schedule like? We do in-house call. We do get a post-call day after. So it's really nice because any doctor's appointments or any like service for your car or anything that you got to do, there's no vacations needed. Just schedule it on a day that you're post-call. Our call is pretty chill while it's in-house. Like we're getting some pages, but it's not like we're doing any admissions. We're not taking, it's literally just answering pages in case of emergencies. And the reason that's important is because we do take medically complex patients. We really push your limits and make sure that you are very, very well trained and skilled at the end of your residency. And that's why we have to have an in-person call, because we're taking some transplant patients, taking high acuity patients. Will there be applicant screening parameters? Dr. Jolene can speak on that. There's a question before about DMC being short-staffed. The truth of the matter is everyone's short-staffed right now. Does it affect our training? Not at all. We still have a very comprehensive experience. We do have a little bit less admissions than we previously did, but our volume was already so much higher than basically so many programs in the country that we're already, doing really well with that. It's almost nice. It's a nice little break for us. So to actually have a little bit less admissions and we're still learning so much. So it's great. Let me see. Dr. Jolene, do you want to answer that question about the geographic screening and preference?
Yeah, I'm sorry. I was typing when you were reading that question. So if the question was, are we participating in the secondary application? We did that last year. We thought it went really well. So if you guys want to share, your geographic preference or some things about yourself that you're really proud of, you can put that on the supplementary application, and we enjoy reading those things.
I know we have a short amount of time, so I do want to cover a couple big points here. First off, we have our own spinal cord injury unit, our own TBI unit. We have the capacity essentially for you to be inpatient on those individual services. When you get out of RIM and residency here, you will be a very, very well-trained inpatient doc, as well as have excellent outpatient exposure. So I just wanted that to be known. We match really well for fellowships. Our previous class, just matched 3 people matched pain fellowship. And then the year before that, 1 matched Harvard SCI, 1 matched Colorado Peds. This guy's probably going to match Harvard TBI, to be honest. We do really well with that. So just FYI, if that matters to any of you guys.
And just to tie up, I think the geographic preferences, Multiple of our my co-residents are from out of state. I don't think there's a specific, I guess leaning bias to one way or the other. Atmosphere is great. I mean, our team members are amazing. Honestly, it's probably the best part of my inpatient experience is working with the staff and my PT and my OT. We have, volleyball teams and sports teams with our therapists. We, hang out with them pretty regularly, honestly.
Camaraderie,
So
Arthur,
the rapport is good. Camaraderie, right? Are we IMG friendly? I mean, one of the residents below the PGY3 is from Dominican Republic. I don't necessarily think, one way or the other. I don't necessarily think we look at the IMG, MD, DO type thing. Honestly, it's if you have a good personality and we think you're good for the program, that's kind of where we're at. I don't, I really don't think we have a preference either way in terms of, where you're coming from.
One last plug, RIM Days, July 28th. If any of you guys are interested in coming to RIM or seeing, our facilities in person before you interview, please feel free to sign up. I left the link in the chat box as well. So